Okay, good evening, everyone. My name is Dr. Aminu Shitu from the Faculty of Veterinary Medicine, Oxford University, Sokoto in Nigeria. I'm one of the admins of the AfriScience network. We are all welcome to the 10th webinar of the AfriScience network. So I'm going to begin by reading the citation of the speaker, who is going to deliver a talk today. Dr. Agaku Israel is an adjunct clinical professor at the University of California in San Francisco. For over 10 years, he served as a senior scientist at the United States Centers for Disease Control and Prevention, CDC. He completed his dental training at the University of Ibadan and his dental public health residency at the United States National Institute for Health in Bethesda, Maryland, US. He holds a master's degree in public health from Harvard University and 2 PhDs, one in epidemiology and the other in health systems. Dr. Agaku is the editor-in-chief for the Journal of Tobacco-Induced Diseases. He has authored over 160 manuscripts in peer-reviewed journals and has also served as an associate editor for the United States Surgeon General's Report, an expert in data science and artificial intelligence. Dr. Agaku is the founder, CEO, and chief scientific officer of Chi-Squares, a startup focused on building scientific tools of the future. You are highly welcome, Professor Agaku, and now you can begin your webinar.
Okay, thank you very much. Thank you
very much, sir.
Thank you, yes.
Yeah.
Okay, please, can you enable screen sharing for me, please? I can't share my screen. Okay.
Yeah, Dr. Yahya, do that. Yeah. Okay.
All right, perfect. Thank you.
Yeah. Okay.
Okay, so I'm sure all of us have interacted with data one way or the other. And when I talk about Chi-Squares as a data collection platform, the most common question I get is, well, we have tons of other platforms for collecting data. We have Google Forms, we have SurveyMonkey, we have Qualtrics. Why do we need another data collection platform? So that's like if I give this talk 100 times, 100 times I'm asked that question. So the simple answer is that Chi-Squares is a data collection platform built by researchers for researchers. And so most of the other data collection platforms you're aware of may be very suited for market research. Chi-Squares is built specifically for researchers. And so there are two broad categories. So this session is by no means, so this is a disclaimer. The goal of this session is not to convert you into believers of Chi-Squares. No, it's just tell you of how we think about data science and how we think of data engineering and how engineering and product science or data science can come together to really improve the quality of science we put out. So Chi-Squares is essentially built for two groups of researchers. The first is people who are doing very advanced research, advanced studies. So if you're just doing a plain KAB study, knowledge, attitudes, and beliefs, well, you don't necessarily have to use Chi-Squares. Because you could easily do that on Google Forms and any other survey platform out there. On Chi-Squares, the emphasis is on, of course, the simple stuff, but also much more rigorous study designs, like longitudinal designs and many others that we'll talk about in a second. The second group of people for whom this platform is built for is people who want convenience. So, of course, I can analyze data, but I don't want to analyze data. I should be able to get my results at the click of a button. So Chi-Squares is for me. So those are the two groups of people the platform is for. Those who are conducting very high-level, cutting-edge research, for whom the regular platforms you have may not cut it. And those who want an easy life and convenience. Now, this is the one screen I'm going to show, and then I'll just do a demo. This screen talks about some of the 10 areas or 10 research challenges that we've addressed in the platform in Chi-Squares. The first is that chi-squares ensures that your studies are not underpowered. Power in epidemiology is the ability of your study to detect differences if they exist. So on the platform, you have sample size calculators for different types of epidemiologic studies, from survey to clinical trials, and so on and so forth. The second advantage is that the platform allows you to be able to draw a representative sample of any country in the world, really. It's one thing to know the sample size for your study. So, for example, if I'm doing a national survey in Nigeria, it's one thing to know that I need, let's say, 2,000 people in the survey. But the other question is, where do I sample these people from? That is a major issue that the platform addresses. It ensures that anyone can draw probabilistic samples from any country in the world within just seconds. The platform also allows you to, like I mentioned earlier, to conduct very, very high-end studies. So it's not just about conducting cross-sectional surveys. You can also conduct longitudinal surveys. Longitudinal studies are studies where you have follow-up over time. The platform also supports experimental designs. For example, if you want to randomize people to different media and capture an outcome of interest, that is also support. I'm going to show you demos of this so you can see what I'm talking about. Seamless questionnaire import. This is 2024. There's really no need for you to spend your time creating a questionnaire in Microsoft Word and then manually copying and pasting in a survey platform. Chi-squares allows you to import your questionnaire directly into the platform if you had already typed it in Microsoft Word. Number 5 is data cleaning. This is a nightmare for many people because the current doctrine for data analysis is you collect data, then you spend this vast amount of time cleaning the data, and then you analyze data. But when you think of data cleaning is like tertiary prevention in public health. This is, you wait for everything to go wrong and then you just try to manage. On the platform, we've thought long and hard about how do we implement data cleaning as a primary prevention measure so that we don't wait for these problems to accumulate and then we clean the data. And so on the platform, your collected data achieves self-cleaning automatically. So that you don't have to spend all that manual effort to clean the data yourself. And number 6, the platform allows you to be able to conduct surveys both on paper as well as over the web. One of the challenges with collecting data on paper is that if you're in the field, it's possible that even if you staple the questionnaires together, they might become separated and mixed up together. And then it becomes very hard to determine, okay, who owns this questionnaire or which respondent answered this sheet of paper. So that becomes very chaotic. And then the effort required for manual data entry is also just unbelievable. The platform addresses those issues systematically. Then the issue of translation, this is number 7. We live in an increasingly diverse society where you may need to, administer your survey in many languages. The platform allows you to translate your survey in many ways. You can use artificial intelligence, you can use manual translation, you can use crowd translation, and many other ways. And then my favorite feature is the fact that the platform allows you to generate comprehensive study reports at the click of a button. So whether those are analysis reports, methodology reports, the code books, the questionnaire, with just a single click, you can download all of those things. And we're going to see, they say a picture is worth 1,000 words and a demo is equal to 1,000,000 words. So we're going to see this in real time for the next few minutes. And then efficiency and cost savings. I mean, the reality is that with all of those features we mentioned, number 1 to 8, that allows you significant cost savings, both in terms of direct costs, like out-of-pocket costs, as well as the opportunity costs. Opportunity cost in economics simply means the time you're spending doing A means time you are not spending doing B. And so that you have significant cost savings in those areas too. And then 10 is collaboration. It's a collaborative platform. That means that you can work together on a project with many people. I like that because for students that supervise for their either masters or PhDs, it's very important for me to keep track on where they are. Because students will always tell you, "Oh, I'm almost done." No, they've not even started. So being added as a collaborator on their projects allows me to be able to track where they are really in real time and provide feedback rather than waiting for self-reported progress. All right, so let's now let's do a project together from beginning to end, and let's see how all of those things tie in together on the platform. So let's go there and see how we can create a survey, launch a survey, analyze the data, generate comprehensive reports, all within the few minutes we have here together. All right, so to get to the platform, you go to www.chi-squares.com. That is a website. So this is the website. If you have an account, you log in. If you don't, you sign up. I already have an account, so I will simply log in. So this brings you to the login page. You enter your credentials. Again, if you're here and you don't have an account, you create one here. So enter my credentials and log in. So these are the various areas you can navigate across the platform. I'll just describe them in a minute before I go on to creating a survey. The survey design is where you create a survey. By the way, this is a dashboard. The dashboard is a centralized area where you can easily navigate from one end of the platform to the other. So the next is sampling. Sampling allows you to generate a national representative sample for any country in the world, like I mentioned. So for example, if I want to draw a representative sample of Nigeria as a country, I'll start new sample. I would select automatically draw representative sample. It's automatic because I want to use the data that the platform will supply. I select the country, let's say Nigeria. If I want to sample not at the level of the country, but at the level of the state, I can select the state. You have all the states here. And this applies for all the countries of the world. But at this level, I just want to generate a representative sample of the country, Nigeria. The platform uses PPS sampling. PPS sampling means probability proportional to size. PPS sampling is a type of cluster sampling. And so on the platform, we use the third administrative divisions as clusters. And so in Nigeria, those will be local government areas, for example. So in Nigeria, you have 775 local government areas. The platform will tell you what you have available. So the question is, how many of those do you want to select for your cluster sample? Let's say I just want to select 100 local government areas or clusters, and my total sample size is 1,000. Once I click on Get Sample, the platform uses that information to generate a representative sample for the entire country. And you have the data both as a table and as a map. So as a map, you can look at the areas where the platform has said you need to go to those areas to select your sample. So here, for example, this is a map of Nigeria, as you can see here. And these are the areas that the platform has selected probabilistically. And so you have the 100 clusters selected. As you can see, just by looking at the map, it's quite evenly spread across the country. So you don't need to be a survey statistician to know that the spread is quite representative. So that's what sampling does. With sampling, you can also upload your own sampling frame. So if you have, for example, your own spreadsheet, for example, that you want to sample from, in this case, you don't select automatically draw samples. You instead say perform sampling on a sampling frame, and then you upload that sampling frame, and you can then select the kind of sampling you want to do, whether it's simple random, whether it's systematic sampling, or whether it's PPS sampling. So that's the sampling feature there. Sample size allows you to be able to calculate sample sizes for any kind of study. So you select once you select that button, you see all the kinds of studies you can calculate sample size for. For example, cross-sectional studies, comparative study with 2 arms, comparative study with 3 or more arms, cluster randomized trials, equivalency trials, and longitudinal studies with staggered entry. So let's give an example. Let's say I want to just do a survey, a cross-sectional survey with percentage as outcome. On the platform here, we've provided some of the commonly used parameters as benchmarks. You can change them, of course, but these are the traditionally used parameters. So level of confidence, for example, 95. The prevalence of outcome, if you don't know it, you can put 50%, because 50% assures you maximum variance for a binary outcome. So that in simple terms, that means that your sample size will be maximized at 50%. So it's better to be, better to be safe than sorry, like they say. So if you don't know it, it's better we aim for the highest sample size possible, so we're more conservative. So once you provide all of the parameters and you get results, the platform automatically will then calculate the sample size for you. You have this button here that allows you to display show the reference. That shows you the formula that was used. It shows you, explains what that formula is. And you can also copy citation. You can also download that formula if you want. So in a nutshell, that's how you calculate sample size. And then you have the survey bank. The survey bank is a repository of thousands of very carefully curated questions. And so if you're doing research in whatever area and you're not very sure of, okay, how do I come up with questions that are valid? Well, that's what the question bank is. You can, for example, come to scientific research surveys, and you can pick the subcategory you are interested in. So, so here, for example, you can look at survey topics or questions, and it doesn't have to be research topics. You can, if you are in education, for example, and you're interested in student experience satisfaction, or campus climate, whatever issues you are interested in, you can come here and then you can look at the surveys available. Let's say you are interested in study habits and learning preferences survey. Once you click the topic, you have the options to add questions to an existing survey. You can copy that entire survey and move the questions to your own survey, and do whatever it is you want with that. And so the essence of a survey bank is for efficiency. There's really no need to reinvent the wheel. So if again, like I said, there's extensive efforts that have been made into creating these questions, thousands of questions on the survey bank. So again, it's just for efficiency purposes, so you don't have to reinvent the wheel. If there's hardly a topic that you'll be researching on that there are no validated questions in the bank. And again, that is to ensure that there is efficiency in how we do research. Again, this is 2024. No need to really just repeat things just for repeating's sake. Now let's go to the survey design now, and let's create a new survey. When you click on that button, create a new survey, you see this modal appears. This is to tell you that the survey supports both cross-sectional surveys as well as longitudinal surveys. At this point, you don't have to pick which one you're doing. By default, it's cross-sectional, but you can always change it at any point in time. And I'll show you how that works. So you set that and let's get started. Now, at this point, you have to provide some basic overview about your study, what's all about. So let's do that. So what's the title of the study? So let's say the title of a survey is, let's say, utilization, let's say access and utilization of dental services among adults. So that's title. Select the location of study participants. Let's say the study is in Nigeria. I'll select that. They provide the aims of the study. You can type the aims manually if you want, or you can generate them with AI by just clicking that button. So if you click the button, the platform automatically will use the information that you've supplied already, and it will supply aims for you. So here, for example, these are the aims that the platform has suggested based on the topic we have selected. So the aims, for example, are to examine the prevalence of dental service utilization among adults in Nigeria. I like that, so let's select that. To explore the barriers to accessing dental services for adults in Nigeria, I like that. Then to assess the availability and affordability. Okay, that's reasonable too. Then let's see. To measure the level of satisfaction, okay. Again, you don't have to select, you can select as few or as many as you want. And then to differentiate the factors, okay, I like this one too, all right. So you select the aims like that, and then you can clear the remaining ones. So these are the aims that were selected. Like I said, you can click here to add more aims. You can type it manually if you want, or you can use AI to generate the aims for you. The same thing with keywords. You can type your keywords manually, or you can generate them with AI. So these are the aims that AI has suggested. So let's say dental service, let's say affordability, satisfaction, utilization. Okay, that's enough. Let's just clear the remaining ones. Now, the next is, so remember again, that this platform is not like Google Forms or SurveyMonkey, because this is a platform specifically designed for research. So part of that is also ethics. So here you are asked to check if any of this apply to your study, whether your study involves elements of deception or coercion, involves sensitive topics. And the goal of the aim of this is to see whether your study needs IRB or ethics approval. All right. So the platform automatically will flag whether your study needs, let me move this out of the way. The platform will automatically flag whether your study needs ethics. For example, if we say that our study involves substantial risk of physical, social, financial, emotional, psychological, or other harm, that's we selected that and we went ahead with creating the study. That tells the platform that there is an indication that this platform, this study might require ethics reviewer. So that is the point. So once you've supplied all of this information here, the platform will then take you to the next step where you can add collaborators. So again, remember, this is a collaborative platform where you can work with many people. So let's say I want to work with, let's say this email, for example, this individual TA at, this is just my other email, I'm just inviting myself. You put their email and then you assign the role to them. Let's say you say I'm a co-lead, or let's say they are co-lead of the project. You can add more and more as you want, or you can just remove it. And you can then save collaborators. So this sends an invitation to them right now so that invited to participate in the survey. So this brings me to this page here where I can see my study. You can see the title we entered, and you can there are options here to add questions as we want. Now, remember we selected that our study might involve some risk of psychological harm. That has triggered this banner here. This says your study may require IRB approval. Click here. IRB, by the way, means Institutional Review Board. I know this is such an American term, but yeah. So you fill this form. Now, if you've ever gone through an ethics approval process, you realize that it's such a nightmare in terms of the inefficiency. There's a lot of back and forth. So on the platform, one of the ways we've addressed that is the platform is automatically linked to an independent IRB, such that when you complete this form and you click on submit, it goes automatically to the IRB. They review it within days or weeks at most, and you get the IRB certificate directly on the platform again. So it makes it very, very seamless for you as a researcher. So in this case, this was just for a demo. We don't really need IRB, so I'm just going to close that away. Now let's create some questions and proceed with that. So you can create questions from many sources. You can copy from an existing survey that already exists. You can import from a survey bank. So the survey bank we mentioned earlier, you can click here to import questions from the survey bank. You can import from Microsoft Word. So if you typed your survey as a Word document, you just import directly, as that document, and the platform will automatically parse the information to create your questions for you. Or you can use an AI builder. So for example, if you want to use an AI builder, you just select the number of questions you want. So let's say I want 10 questions with AI. I just select 10 and say generate the questions. The platform will then automatically generate questions for me. So here, do you currently have access to dental services? Which are following factors do you prioritize? And so on and so forth. These are all related to the topic we selected. If I'm interested in them all, I can select them and I import them. Well, I'm not interested in them. I just want to create my own questions. So I will say no to that and move on. The same way with importing from the survey bank. If we imported from survey bank, it takes us to the survey bank where we can, review. We can add the tags we want, like dental, oral, teeth, and you will search for if there are questions to that effect. Of course, there are the platform has 21 questions at the 21 questions on the topic of dentistry or oral health. And so you can review, and if you want, again, you can select the ones you want and you import. Again, I'm not interested in that, so I will just go back to my survey. I want to just create them manually. So I'll just choose blank survey. So the platform has dozens of question types for you to create your survey. So I want to select a multiple response question. So let's say that we want to make sure our survey is only among 18 years old, people who are aged 18 years or older. So let me first of all start with the question that has to do with age. How I'm going to make them very, very simple so that we can analyze and see how everything happens in just seconds, literally. So how old are you? Again, this is for demo purpose, so it's going to be very simplistic. Now, one of the ways the platform addresses issues of data cleaning automatically is that, like I mentioned earlier, is primary prevention, right? The way data cleaning is handled, or data architecture in general is addressed on other platforms, is things like assignment of names is done after you collect the data. You collect the data and then you start struggling how to assign variable names. On the platform, we do that at the very point when you are collecting your data. So here we've asked the question, how old are you? Now, here you see you have to type a label. These labels are what will later on become the variable names. And you can type them manually yourself, or you can ask AI to generate it for you. And so the AI these are the suggestions that AI has generated, for example. You can select anyone, or you can type it yourself. So you can either get suggestions from artificial intelligence, or you can type it manually yourself. So let's say we have that, and the options are less than 18 years, or again, I'm keeping this very simple because this is just a demo, 18 years or older. We can then add the options here. We also have a feature called Explore. Explore is to allow you to be able to generate values from system values, things like lower and upper limits. Let's say my lower limit is, let's say 1914, and that's the lower limit, and the upper limit is 2015 or 2024. I obviously don't want to start typing the individual values by myself. You can use lower and upper limit. So somebody has a question. Tahir, you have a question, or do you want to ask now, or you want to keep it for later? You can type the questions in the chat box, or you can just keep them and I'll answer them at the end.
Yeah, I think we should entertain questions and answers at the end of the talk.
Okay. All right, sounds good. All right. Yeah. So if you want to use system values, so if you want, for example, countries of the world, obviously you don't want to sit down there typing all the countries of the world. You just select countries of the world and apply, and automatically the platform will apply that. So that when you are selecting the answers, and this is the preview, this allows you to see how the question will look when participants are answering it. So if you look at preview now, see how old are you, it has listed all the countries of the world, right? The same thing if I wanted to explore continents, for example. I select continent. If you go to, it has changes to continent selection. If you go to preview, you see how old are you continents. Of course, I'm interested in just my user supplied text entry, so I'm going to put that, and it goes back to this. And then I push to the questionnaire. And so that's how you create questions on the platform. Now let's add a few more questions and then go to data collection and see how that works out. So let's add another question type, maybe another MCQ that says, how many times in the past 12 months did you visit a dental care provider? Again, you can add pictures if you want. So you can make your questions, you can make your questions illustrated. So for example, I can upload and choose to add an image to the question so that the participants first view, oops, how do I pull this? So the participants can then, first of all, view let's see if I can find a good image here. see. So I've added an image here. The platform then says, please view the media below, then answer the question that follows. So, sorry, that's a corrupted image. But then if that was a you know a high quality image, you can then see the image, and then you can then answer the question. I'm not interested in adding a picture, so let me remove that. So how many times in the past 12 months did you visit the dentist or dental care provider? I can add a label manually, or I can get suggestions from AI. So again, I click get suggestions. These are the suggestions that AI has provided. Remember that the labels eventually will become the variable names. So let's say dental care. I say never, for example, one time only. 2 or more times. Let's say other. The other field allows you to be able to, when the user types, when the user selects the other, the platform will then automatically supply a text box for them to enter the answers. And you can change that order to whatever you want. It doesn't matter what you type there. The platform recognizes that selection as a special button. And so regardless of what you type, let's say we typed here some option not specified. Right. So it doesn't matter what you call it. By the virtual fact that you select that button, the behavior by just how you look at it is the same as the other buttons, but programmatically it's different, so that the platform knows that that button is special and that you're meant to be supplied with a box to select that. And so we add that, and we can push that to the questionnaire. Let's add a few more questions, and then we can take the survey and see. Let's look for a different type of question. Let's look for a sliding scale. On a scale of 0 to 10, how well equipped, let's say, do you think the healthcare facilities in Nigeria are? So you can now put a scale. Let's type this manually ourselves. Scale. You can choose, whatever lower limit you want and whatever upper limit you want. You can also choose the steps between the limits. This is done automatically. The platform take notes of the upper and lower limits, and to automatically display to you the steps that are valid, and then you can choose them. And then now my personal favorite on the platform is experimental questions. So let me just demonstrate one of those. Randomized allocation questions, randomized trials. So if I wanted to randomize people to different things, you would upload the images that you want to randomize them to, and then you can then create a question. So let's say select upload files. So let's say these images, sorry, these are not really good images, but let's upload them. So I can then type the labels of associated with each of those. So and then let's say I'm just typing gibberish now, and then apply if I wanted to create such a question, but I do not. So but I just want to showcase to you that the platform has the potential to have those experimental question types. Now, one of the things we also try to do is to provide some education. So you can look at the tab by the right, tells you what kinds of questions, everything you need to know about that. And that's purely from an educational perspective. You can also translate your survey into any number of languages. So for example, the survey is in English. Let's say I wanted to administer the survey in, let's say, Pidgin English too, for example, or Spanish. There are different ways you can translate your survey. You can use AI, artificial intelligence. You can use manual translation with the templates, or you can use a web form. So let's say I want to use a web form. I select the language I want. If the language is not on the list, I can click here to add the language. So let's say I select team language, which is my language. And then you have this, you now have to now start typing in here the languages you want, the equivalent, the target language, right? This is the title, you type it in here. I'm not going to go through it just for time. But once you're done and save translation, the platform will administer the survey in that language as well. So that's just showing you one of the features that exist there. This is the collaborators page. Like we said, I invited this individual. He has not accepted yet. That's why it's still showing as pending. Then this information bar tells you everything about your survey. Here, for example, you have the scheduled start date. I've not set that yet, so that's why it says TBD, to be decided. I selected one country, and it's a cross-sectional survey. That's why it's one cycle. It also tells you the readability of the survey with the Kincaid score. So the English I have provided here is at the 8 and 9 grade level, and it says this is plain English, so that's great. So it allows you to assess the readability of your survey. You can also offer incentives. So you go to settings, and you go to incentives. Right now, it's set up at no incentives for anyone, but I can choose to offer a raffle draw. Let's say I don't have a lot of money. I just want to do a raffle draw for 1 or 2 people. That can work, or I want to pay everybody. So in that case, like, okay, how many people are in your survey? Do you want to pay? Let's say 200. How much do I want to pay each participant? Let's say $5. Once I save that, then I'll have to check out and pay, so that means 200 times 5 is $1,000. I have to pay that money now. And then I can, as the survey commences, I can check the disbursement history here to see how that money has been paid out to participants. So the platform also allows you to be able to offer incentives. You can have reminders if you want the platform to automatically remind people to take their survey. You can specify the times when such reminders should be sent. All right. The preview button here allows you to see how the survey will look like before you launch it. So if clicked on the preview, for example, this is English because this is the only language the survey is in. If we had translated our survey in multiple languages, the user will then click here to select the language they want to take the survey in. And then we can then start our survey. How old are you? We select that. Now we can then take the survey to the end. Now let's say that we want to restrict the survey only to people who are aged 18 years or older. That means that we have to incorporate logic into our survey. So we'll come back here and say inclusion criteria. The inclusion criteria determines who gets to participate in the survey. So right now we don't have an inclusion criteria, so let's set up one. So let's say that our inclusion criteria is based on age. How old are you? Let's say done selecting. So include participants if age is exactly 18 years or older. So we can select that here. You also have a whole bunch of other operators, not equal to, if age is containing, that is if you have different values, or if age is starting with or ending with. But here we just want a very specific value. So we can say if age is exactly equal to this, then this participant will be included. So let's submit. So please note that questions with these labels are currently optional, okay? So I have to, for a question to be used in inclusion criteria, it has to be mandatory. So that means that I have to come here and set the question as mandatory. So the platform gives you those statements so that you can know what to do in specific instances. So here you see make required, and click there to make required and update the question. So now I can now go back and set my logic. So again, this was this. And we're done selecting. So if age is exactly equal to this, let's include 18 years or older. And okay, let's see. Okay, I have to make that mandatory. So here you go to rearrange questions. This is where you can keep the order of questions in however you want them as fixed. Or so there are three settings here. You can keep all questions fixed, shuffle all questions, and fix some, shuffle others. So this allows you to set the relative order of questions, one relative to the other. But for the sake of time, let's just go ahead and just launch this survey now and see how the platform analyzes it. So because that's a very key part of our demonstration today, the analysis. So when you set on launching your survey, you have these things here. You can set up study timeline. So here we can say we want to launch our survey now, obviously, and this is the closeout date. Let's say we want to close out our survey on the 18th. And then you can also set other things here. For example, whether questions should all be required, whether you want to allow people to go back and edit previous questions, and so on and so forth. There are so many options for you to decide. So once you do that, you can save the settings. And now we can launch our survey. So we've set our timeline. So let's launch the survey now. If you have participants, let's say you have a spreadsheet that contains the email of participants, you can upload the emails as a spreadsheet. But for the sake of time, we will not do that now. Let's just go ahead and launch our survey. Now, if you have flags in your survey, flags that maybe mistakes you did, the platform will not allow you to launch. So see here, it says you have pending flags. Again, so that's to protect you from yourself. So if we come here and, oops, sorry. Let's go back to the survey we're doing. Go back to our survey page. Access and utilization of dental services. So you can see we have one flag here. So that is what is preventing us from launching our survey. We have a translation we started, but it's incomplete. So we either finish that translation or we remove it. So let's just remove the language so that we can go ahead. So now we don't have flags anymore. So now let's go ahead and launch the survey. Launch now. So the survey has been launched successfully now. So that means that people can participate in the survey. So let me create a link to the survey and let me share it so that those of you who are able can participate. And then it's just 3 questions so that we can collect the data and see how you analyze the data in just seconds. So let's generate the link to the survey. So this is if you want to get a QR code and share, you can do that here, or it's the link, you can copy the link. So I'm going to drop the link here on the. So if you guys have a second, just take a survey so that we can now see how the data is managed or analyzed in real time. So I've dropped the link in the chat box. So I'll take the survey 2. Let me take the survey 2. So start mine. How many times have we said that? Is it never? So I've taken my survey. So if you come here to manage collected data, you'd be able to track how many people have so far 3 people have responded to the survey at this point. So so now let's just go ahead and see, for example, how the study, I want to get a few more responses before we pursue the analysis. Okay.
My connection is very slow. I'm trying to open the form.
Okay. Oh, okay, already. So we have 7 respondents now. So let's go ahead and analyze the data. you can analyze the data on the web, but you can also download reports that are generated for you automatically. So let's look at the methodology report. So there are 4 types of reports you can generate. You can generate but before I go to the reports, let me show you another feature. Let's say you wanted to do a survey in, let's say, a part of a country where there's no internet. One of the things you can do is that you can download your survey as a paper survey. So when you come to this questionnaire designer, come to paper and pencil questionnaire, you select that, and then you can, let's say I want to administer 2 questionnaires. Let's keep it simple. 2 questionnaires as paper surveys. I will type the number of questionnaires that I want to download, the number of people I want to administer. If it's 200, I will type 200, and I'll select the language. In this case, we have only English. So we'll select English, and then we continue to download the questionnaire. What happens is that the platform will automatically generate a customized survey questionnaire for each of those individuals, right? So that when we download this here, let's go down and grab this. So this is what was just generated. So you see that each of this is so this is the study project number. This is the last number here is the respondent, the individual. So this is individual number 1. So you see that they are special, these are machine readable numbers here. So you just take this questionnaire. So the downside is that you cannot make photocopies of this because each is specialized. So this is individual number 1. Individual number 2, you see, this is their own special questionnaire, right? So you cannot make photocopies of this. You print it out as it is, and then you go and administer it to participants as it is. Now, when you administer it, it doesn't matter whether the pages were shuffled or mixed up or what, it doesn't matter. The platform will automatically read those answers and would, and would recreate the data set from those responses. You can also choose to enter the responses manually if you wanted. If we have a minute time, I'll show you how, but the point is that the platform completely eliminates the traditional way of collecting data on paper, which is so error prone. Now let's go back to our survey and go back to the download of other reports. So you can download the questionnaire. You can also download the other reports like the methodology reports. The methodology report tells you how the study was conducted. So let's download that quickly for this survey we've done. So it's still downloading. It's finished downloading, so we can go to our download history to grab it. So this is the study report. So let's pick that up. So the platform automatically writes the entire study report for you, for how the study was done and everything. So that if you're writing a manuscript or your thesis or whatever, you don't have to spend all of that time doing that manually yourself. So this is a report that the platform has automatically generated. This is the title. This is the survey ID. This is the keywords. This is the time of report download. It gives the introduction by itself. It talks about the study design. This was a cross-sectional design. It tells you the dates that were planned and dates that were actually collected. It describes the study participants. Here we have 7 people. It talks about how the survey was administered. It discusses the questionnaire. In this case, in the survey, a total of 3 questions were included because there were only 3 questions. It talks about the limitations and everything. So this is, the platform automatically generates that for you. Now, in addition to the study report, you also have the codebook. The codebook allows you to be able to see what a particular value means. The codebook is also not a data dictionary, right? So you can download the codebook for the project as well. That has been downloaded. So if you view our download history, you can look at the codebook. So let's grab that. So this is the codebook. It tells you what everything is. Like I said, it's a data dictionary. It tells you what every single thing are. The platform also automatically tracks the response while people are collecting the data. So it knows which ones are duplicates. So if you did a survey twice, the platform will flag that. That's what we call suspected duplicate entries. If you put straight lining, so straight lining is where you put all the answers are A, platform knows that that's obvious, that's a suspicious answer pattern. It will flag that. If there are large amounts of volume of responses that are missing, the platform flags that. If you sped through the survey, the platform tracks that. So the top 5 percentile of speeders are flagged. And so based on that, the platform assigns a data quality score. So this is all in the code book. Then the different questions and how they are coded in the data is also all captured automatically for you so that you don't have to create this manually. Now let's go to the analysis.
That one is 744. You write 744.
So
just like I wrote it, and you splitted it into
this is the analysis report here.
This one
So
is...
when you click on the download analysis report, you can either choose to download for a subset of a population or for the whole population. So this is a small population. So let's download for the whole population. So it's finished downloading. So we can come here and view the download history and view the survey analysis report. And let's grab that. So what the platform does for each of the questions, it produces the analysis for it, both as a table and as a figure. So this is the report, access and utilization of dental service among adults. This is the survey ID. This is the analyzed population, all participants, 7 of them. And this is the date and time of report. Question 1, this is how old are you? 100% said, 18 years or older. Question 2, multiple choice question. How many times in the past 12 months did you visit a dental care provider? These are the responses, the counts, and the percentages. This is the distribution here as a figure. Number 3, the sliding scale. This is the denominator, 7 people. And so you have the mean of the responses and the standard deviation, which is presented both as a table and as a figure. So regardless of the type of questions you have or however they are, the platform does all the analysis for you automatically, so that you can generate your questionnaires, your study reports, your code books at just a click of a button, And then there's several other features in the platform that allows you to to look at the quality of responses, to look at the extent of contribution of your collaborators, and so on and so forth. I'm going to stop here and see if there are any questions, so I can allow you guys to ask any questions that you have too.
Thank you very much, Dr. Israel Agaku, for a brief and wonderful presentation. I can say that it came at the right time. We are celebrating our 1-year anniversary. The AfriScience Network was created exactly on March 2023. And we are facing a challenge of how we can analyze the data set, the membership information that we collected through Google Form questionnaire. And we have, I think, close to 6,000 members. So I'm looking for ways on how we can analyze that to classify membership by gender, by country, by profession, etc. I think this is going to be a good platform to play around with and see what we can make out of the questionnaire that we have gathered so far.
Definitely.
Could it allow? Yeah, I was wondering whether the system could allow us to upload the questionnaire in an Excel file, and then we can go ahead and do that at a click of a button.
So you are saying the responses have, let me just be clear, right? You already have the data. So it's not as if you're about to start data collection.
We have been collecting members information from, and we have been sharing and resharing the link, asking people to subscribe. And I think we have accumulated up to that number of members, about 6,000. So now we need to just play around with it to make a sense out of it, to publish a report about membership, sort of a directory of membership by country of residence or by country of origin, and also by gender, by specialty, classification, and so on and so forth. We have that information already.
Okay.
We use Google Form Survey. So if we download it in an Excel format, that is an option to upload it on the Chi-Square platform for the analysis?
Not now, but so this is just a small fraction of the Chi-Square platform. This represents a small fraction of what we're building. By the end of this year, we are building the full platform will be released, where you can literally write an entire manuscript within 30 minutes. That feature, that full platform will allow you to do that. But for now, this part we've released is just for data collection. So that means that you must have collected the data on the platform to be able to do all of those things.
So everything has to do through the Chi-Square platform?
That is correct, yes. Unfortunately for now. Fortunately for you, yeah.
Yeah, thank you so much. Thank you
very
much,
welcome.
sir.
Yes, you're welcome.
Dr. Yahya, he was trying to catch up with the boss, so he made you an admin.
Okay.
Let me check. Yeah, I think there are 2 responses in the chat here.
Okay, let's see. So somebody is asking for a link to the Chi-Squares platform. This is www.chisquares.com. So that's the link. Let me respond to everybody.
Okay, so the Chi-Squares, it's CHISQUARES.com.
Yeah, like Chi-Squares, CHISQUARES.com, yes.
And somebody asked, is the platform free?
So you can absolutely have a free plan. So let me show you this slide quickly. So there are tiers to the platform. You know, there's a free user, right? The free use account can allow you to do so. You can do a survey on a free plan too. But you know, so many of these things are very high, incur a lot of costs in terms of just space management, or you know, like consumption of AI services. Those things are quite, you know, quite expensive. And so for the free plan, there is obviously a restriction in the extent of what you can do on the platform. But you can still do a survey, you can do your analysis, you can generate reports, all of that on a free plan. You can translate your survey, right? But you're entitled to just 1 survey in a year, and there's no limit to respondents that you can have in your survey. So in that 1 survey you have in a year, you can have 1 million participants if you want. You can have 1,000 questions if you want. Now for the members of this organization, we're doing a, you know, we're allowing members to have access to the platform for absolutely free for the next 60 days. So if you can see my screen here, we have a promotional code, KEYEKN. Can you see my screen here?
Yes, sir.
Okay, great.
Yeah.
So you apply this code, and there's a video here. Let me drop the video in the link. So you can watch this video to see how to apply that code. So that gives you the premium access to the entire platform for the next 2 months, I believe, a few months. I'm not sure when that ends, but so that way you can play with all the features, and you know, so watch that video to see how you can apply that code. And please, we want as many people on the platform, on the AfriScience platform, to have access to it, so you can share that with them. And then we're also very interested in issues of health equity. So that means that one of the things we're doing is that even after this period ends, for all people who are from low and middle income countries, there is a 50% discount of whatever plan you choose. So if you choose for a plan, for example, that is, you know, let's say $49 or $50, you only pay half of that price perpetually, because you know we're obviously very interested in use of health equity. So those are some of the ways we've taken to address that and make, you know, scientific tools more accessible to our brothers and sisters in low and middle income countries. Okay, the question is, does the platform have a maximum limit of data it will accommodate? No, the platform can scale almost indefinitely. So that literally what that means is that you can collect data, you know, that amounts millions of respondents or tens of millions of respondents, depending on how large your survey is, right? There's no limits to how Of course, there's always a theoretical limit, but practically there's no limit to, unless you're collecting responses in the billions, which I doubt, but you know, there's no limit to how much that can happen. How about validations and standardization issues? Yes, we've taken extreme care to make sure that issues of, you know, again, this is a scientific platform, and science is all about accuracy, precision, and reliability. So the platform has been extensively tested to make sure that, you know, all of these issues are addressed. Let's see, any other questions? Okay. Okay. Any other questions? Let's see. Could this platform be used for qualitative data? Yes, you can absolutely use the platform for qualitative data. So let's say you have a let's pause our survey so we can add some question types that are qualitative. So you can add questions that are open-ended. You can ask people to, so let me show, for example, there's a whole bunch of open-ended questions and multimedia questions. So I could say, for example, please record an audio of you discussing your challenges. All right. I can then select, you can collect video responses, audio responses, photo responses. Here I want an audio response, so I'll select audio. And then I can now push questionnaire so that when I preview the survey, or when I'm collecting the data and I get to that question, I will just collect I'll collect audio responses from allow that audio responses from my participants, you know. So so there's no limit to what you can do in terms of, you know, kinds of data you collect on the platform. Are there scientific manuscripts published about this problem? Yes, we have manuscripts that have been accepted for publication, and so those will be released very soon. And so we'll be happy to share with you as soon as they're released. For the paper surveys, how do one impute the data for the system to capture? Okay, the paper surveys, right? Let's go back to that's a good question. So let's say in this survey here, let's say the individual answered questions. So let's just pick up some answers here. Let's say the individual answered less than 18 here, this response here, and then they answered this here, and then the respondent number 2, let's change the ink for them. Let's make this blue. Respondent number 2 answered this here, for example. And then they answered this here, and then they answered this. Now, one of the problems with paper surveys is that you have a lot of problems when you go to the field and responses get mixed up. So let's say, for example, we go to the field and unfortunately, this happens such that, let's see, this, I'm trying to rearrange pages, organize pages. So let's say we go to the field and instead of questionnaires being very nicely arranged the way they are, we have something like this happening.
I'm doing lecture. Cool, be cool.
So let's say the questionnaires are all mixed up. Okay, my computer is suddenly becoming very slow. So let's say they're all mixed up, right? Which is very realistic. This is what happens in the field all the time. So this something like this now. Instead of a nice arrangement you had complete shuffling of the questions. There are 2 ways to now take your answers and bring them into the platform. The first way is to through AI. Now that system we're still building it, so we've not released it yet. But we don't release products until we're 100% certain of the accuracy. So the AI system for this particular system coming up in the next few months. What we have provided for you is a manual way of extracting it without having to worry about where the questions were mixed up or not. So let's try and do that for this. So here you can see the questionnaires are all mixed up, right? This is the first individual, they all completely mixed up. And so let's see how that works. So you come to your platform here, and then you come to manage collected data. Then you see manage paper response. You see that here? You click manage paper response. Here it says I don't have a paper response yet, so I have to submit the paper response. So I click there to submit the paper response. So this is where I will type my responses. Again, we are building an AI system that will do this automatically, but for now, we provided you a mechanism to at least enter the answers without having to worry about whether the questionnaires were all mixed up or however. So here, I will now copy the answers. I will copy the numbers in front of the answers only. So here, let me expand this. What's this? So here, this individual has selected this answer. So I'll copy or type that first value. Then here, this one has selected this. I'll copy or type in that one. Then here, they have selected this one. And I'll copy or type that in. Then this one, they've selected this. I'll copy or type it in. Here, they've selected this. I'll copy or type it in. And here, lastly, they selected this. I'll copy or type that in. So you now submit it. The platform will then take that responses you've submitted, and it will do some reverse engineering of the data and recreate the data sets and add it back to the responses. So there's a lot of quality assurance that takes place here. So you have to give it some time. That's what we're telling you here. A few minutes, not as if it's hours. So we'll come back to this in a few seconds, and we'll see what the status is. And then we'll now go back to the data set and look at how the responses have compared. So that you can see, this is 100% accurate. So while we wait for it, let me answer the other questions that.
Yeah, I think the first answer there is yes.
Let me see. I can't even see the questions. Let's see.
We have two questions from Michael, and the first question was, will the video of the meeting be made available? And the answer is yes. All our videos will be made available on our YouTube channel. And the second question there is, you mentioned that this platform will be able to generate manuscript in the near future. Will AI detector not flag the manuscript as AI generated?
No, because we're not just putting a manuscript obviously into an AI system, and AI cannot write a scientific manuscript, right? Or AI can write articles, but not all of them. And so we have a risk assessment, algorithm or framework. And so we look at two things, right? We look at so on one side of the framework, we look at, can this be done by rules-based programming? Rules-based programming is where you write logic in a computer algorithm and say, if A happens, do B. That's rules, right? That's quite different from AI. If the answer is yes, then we always follow rules-based algorithm. Right? We only use AI for things that it's impossible for you to implement with rules-based algorithms. And then the other axis is, what's the level of risk associated with this activity? And we'll classify all activities as either low risk or high risk. So anything that has to do with data is high risk. So if any activity touches data, it's high risk, whether it's metadata or your response data, or And so based on that framework, you can see that you can divide the parts of the manuscript into two areas, high-risk areas and low-risk areas. The high-risk areas will be the methods and the results. Those have to do with data, right? Then the introduction and the discussion are relatively low risk. Our approach to developing manuscripts on the platform allows, rules-based programming to develop the methods and the results automatically. It's automatic, but not AI. So not all automatic actions are AI, obviously. Like I've explained, it could be rules-based programming. But this is something that you have to see, to believe, or to understand. So I'm going to hold that explanation until when we release it. You will see, I mean, you see how just amazing the platform, how before your very eyes, a manuscript is generated, and how it's just, of the topmost quality. And so I think it's easier to explain some things when you see them. So let's hold off this explanation until 6 months from now. And then when we release that feature, you can see with your eyes how that happens. And then I will better be able to explain to you then.
Yeah. Okay. And I think there is another question, like if I use this platform, how can I reference it?
So the reference in general, I'm the editor-in-chief of a scientific journal, and the general framework or the general principle is we generally try to reference only material that have been peer reviewed. So peer review means that you submitted the work to a journal, and your other scientists review the work, and they give a thumbs up, right? In general, what we're doing here is just making your life easy. This is not peer reviewed, apparently. So you would still have to, if you wanted to publish, you still have to take the work and submit to a journal and have it peer reviewed. These are things that you would have normally still done by yourself manually. All we're doing here is saying, let's just automate it. So our mantra is human effort where necessary, but automation where possible. And so that's just the framework. So I hope that clarifies.
Yeah, I think there is this software that I used about 12 years ago, Maxent, maximum entropy for species distribution modeling. And if you use that software, there is a way you can reference it to mention the name of the developers and their institution as well. So yeah, I think that is what that question is saying. Is there is a way I can say within my reference list, I can list your name and then chi-squares.
Oh, okay, I see your point. Okay. So
yeah.
If you do, for example, sample size calculation, right? Let's go back to the sample size calculation. Let's say we generate a number here. Let's just get a random number. So you see show reference. When you click show reference, there's at the end you have citation here. So you can just copy the citation. We've automated that, so you don't have to start copying it manually. You can just copy it by clicking that button, and then it's copied entirely, and then you can go and use it wherever you want. You just go and paste it wherever you want.
Yeah, I think that answered the question.
Okay,
so
great.
I cannot see any response here, any reactions. It seems like we have exhausted all the questions.
Okay,
and
for people, again, like I said, the website is www.chi-squares, like you have chi-squares here.com. So that's where you get access to the website.
Yeah, exactly. This presentation will be shared. It will be uploaded onto the YouTube website, so that other people that have missed the webinar will watch it at any time of their convenience. And yeah, in the absence of any questions, once again, I would like to thank you, Professor Israel Agaku. You really made my day, and also the fact that we have one thing in common, which is quantitative epidemiology, and yeah, so I'm really glad, and I'm sure that I'm not the only one. I would like to thank you so much for your time and for sharing the knowledge, and also to pray for more wisdom on you and on all of us. Yeah, thank you so much. Thank you very much.
All right,
we really appreciate it. Yeah, and we are looking forward to collaborating in the future. Yeah, thank you very much.
All right, have a great day, everyone.
Thank you very much, sir. All right, take care. Bye.
I'm the host, so who should I assign? I have to assign.
You can you say, I don't know how it will work. What are you seeing? What I'm seeing here.
It's end meeting for
Here it
all.
only
Let me assign to you.
okay. I think I was about to say leave. Okay, I can say end.